Everybody. My name is Sarah Duzinski. I am the Vice President of Quality Assurance, and I'll get over to Akram to introduce himself.
Hi, everyone. My name is Akram Altark. I'm the Director of Research and Evaluation at ECHO.
Wonderful. Thank you, Akram. So today we're going to be talking about our HMIS Snapshot. It's the 2021 Homelessness Prevalence Estimate in Austin-Travis County. It's kind of an alternative methodology to our traditional PIT count. And we will also be presenting HIC data, which is the Housing Inventory Count or sheltered data. Next slide, please. So we're just going to give you a quick overview. I'm sorry, Chris, can you go back? We're going to cover background, alternative methodology, limitations, results, some key takeaways, and current and future efforts. Next slide. All right, so just a little bit of background, and again, go ahead to the next slide. Talking about the HUD exception. So as many of you know, HUD granted Austin-Travis County an exception to conducting an in-person PIT count due to COVID-19 for 2021. Instead, we proposed an alternative, and that was to estimate unsheltered homelessness in the Austin-Travis County Homeless Response System using the HMIS database, or the Homeless Management Information System. And the rationale for that was, at the time in November, there was a very high COVID-19 case count in Texas and rising cases in Austin. There were local public health restrictions on social gatherings. We also know from the scientific literature that the homeless population is at higher risk for COVID-19, complications and death. Also, our homeless response system staff were stretched very thin due to COVID-19 emergency response. And we knew that a lack of volunteer surveyors could lead to an undercount, and we did not want an undercount. Next slide, please. Okay, so just some notes on the homelessness response system and COVID-19. So many shelters, or all shelters really, had to reduce their shelter capacity in order to abide by the CDC COVID-19 safety guidelines for social distancing. In addition, our community put up protective lodges. So they were operating under the Austin-Travis County EOC as public health response for people experiencing homelessness who screened high for COVID-19 complications or death. At the moment, we now have 4 pro lodges in play with a total capacity of 290 units or households. And we had many entities, community agencies, nonprofits, service providers that coordinated together alongside the city of Austin to provide food, supplies, and services. We also had an expansion of rapid rehousing programs to house people directly from the pro lodges, particularly towards the end of 2020. And in addition to that, many of our homeless response partners put requests for donations of tent and camping supplies on their websites to help people experiencing homelessness socially distance during this pandemic. Next slide, please. And so another factor at play in the during COVID-19, during the pandemic and the attendant financial crisis was an eviction moratorium or various eviction moratoriums. The one in Austin really made a substantial impact. You can see here from 2014 to 2019, we hovered just under 200 evictions per week in our community. In 2020, beginning right around March, the eviction filings by week went down to very low, under 20 or 30 a week. So that has really helped prevent a rise in homelessness. And it's also, we think, a bit of a sleeping giant. Next slide, please. So one thing that has definitely been at play is the increased visibility of homelessness. So back again to the reduced shelter capacity, shelters following CDC guidelines for COVID-19. They really, many of the unsheltered population have been displaced from shelters. And in addition to that, there are many people who would have normally felt comfortable accessing shelter who've reported fear of contracting COVID-19 in congregate shelters. So those people have also chosen not to be in shelter. And then those tent donations for social distancing have increased encampment visibility. In addition to that, the CDC guidelines on encampments, the CDC, in order to prevent COVID-19 spread, issued a statement that if housing options were not available, that people living unsheltered or in encampments should remain where they are. And then lastly, we had lower housing turnover due to COVID-19, and that has increased the average length of unsheltered homelessness during the last year or so. And so the amount of belongings that can accumulate increases the size and visibility of campsites as well. Next slide, please. So I'm going to hand it over to Akram to discuss the alternative methodology that we used this year. Thank you, Akram.
Okay, thanks, Sarah. So as Sarah mentioned, we did not conduct an in-person count this year, and our alternative methodology uses HMIS data. So the way we estimated unsheltered homelessness this year is we used data from our local homeless management information system, HMIS, which is the centralized database that's used by service providers. And what we did is we pulled that data from HMIS on January 28th to get a snapshot of homelessness on that day. So that would have been the day that we would have conducted the PIT count, in-person count. What we did is we pulled the data on that day to get a snapshot of unsheltered homelessness. Then we counted the number of people who in HMIS were unsheltered, they were seeking permanent housing interventions or services, and had interacted with the system in some way. Maybe they had entered a day shelter or worked with a case manager anytime in the prior 180 days before that date, before January 28th. So that's the reason we use that date, that number, 180 days, is because that's the average length of unsheltered homelessness in our community right now. Next slide, please. So again, what we want to do is we really want to point out the differences between the traditional in-person count and this year's methodology. And again, this is just for the numbers that you're going to see for people experiencing unsheltered homelessness. So the main goal of a traditional in-person PIT count is volunteers and staff who go out and count the number of people experiencing unsheltered homelessness on one night. The HMIS method, we also are counting the number of people on one night experiencing unsheltered homelessness, but we are counting the number of people in HMIS who are experiencing unsheltered homelessness and who are seeking permanent housing services. One of the advantages of PIT, the in-person count, is that it includes people who volunteers and staff may see on that night who are not necessarily seeking housing services. With the HMIS method, one of the main advantages here this year was that it actually provides us a more accurate snapshot of what is happening in the system, what is happening in our homeless response system. And also, because the data that is in HMIS is collected by case managers and and by assessors, people are building rapport with case managers and service providers, and they ask them a number of questions about themselves. And so what we have here is more detailed subpopulation and demographic data compared to the PIT count. One of the main disadvantages of the in-person count is that, there's been a lot of research to show that PIT is most likely an underestimate, an undercount in most communities in the United States. Also because it's only for a few hours and you're not really able to collect a lot of demographic data. There's incomplete demographic data and subpopulation data in PIT. We also want to point out the limitations of this year's HMIS method. We note three here in particular. One is that not all service providers who work with people experiencing homelessness use HMIS. The second limitation this year, and this is especially because of the circumstances of the last year and a half or so, or a year, that it's been really, challenging to administer virtual assessments during COVID-19. a lot of things are happening virtually, either web or on the phone. And so it's been a little bit harder for staff to, kind of interact with people experiencing homelessness. And circumstances change often for people in HMIS. Sometimes, we might think someone is experiencing unsheltered homelessness. Maybe they have found something, maybe they've self-resolved their homelessness and we don't know about it quite yet. So that's another limitation of this method. Next slide, please. So now we'll preview the results. And let me caveat this, or the main thing to note here is that all of the numbers in this table use the same method. All of these numbers, even from 2019 and 2020, are using the HMIS method, for especially when we talk about the unsheltered count. So these are not the PIT unsheltered counts. This is the HMIS method unsheltered counts. So in 2021, on January 28th, there were 922 people who were experiencing homelessness either in a shelter, in a congregate space, or in one of the 5 at that time pro-lodges, the non-congregate crisis facilities that were stood up by the city of Austin in response to COVID for people experiencing homelessness. So there were 209 people staying in those pro-lodges on that night. There were about 713 people staying in a traditional in a shelter facility. So that's 922 people staying in crisis lodging. That's about a 1% decrease from last year. The unsheltered count, again, using the HMIS method, there's 2,238 people in 2021, again, on January 28th of 2021. And that is about a 1% decrease from the 2,262 that were experiencing unsheltered homelessness in January of 2020 using the HMIS method. So you can see here the total this year was 3,160 people. That's about a 1% decrease from 2020, again, using the same HMIS method. The data here come, again, from HMIS. The pro-lodge numbers come from the City of Austin's Emergency Operations Center. Next slide, please. And this is just a visual representation of the same data from the previous slide. So the left-hand panel on this slide shows the same numbers, but we also wanted to show that the relative, the number of people experiencing homelessness per capita in Austin and Travis County. You can see, we all know that Travis County continues to grow. These numbers are from the census or from the Texas Demographic Center. This is the population in Travis County. The right-hand panel on the slide shows the number of people experiencing homelessness per 1 million people living in Travis County. And the main takeaway here is that that number has stayed relatively stable. Next slide, please. So now we look a little bit more at subpopulation and demographic breakdowns of people experiencing homelessness this year. As you can see here, a little more than 2/3 of people experiencing homelessness report living with a disability. That's people who report a physical, mental, or emotional disability. About half are chronically homeless. About 41% report being a domestic violence survivor. 34% are living in a family with children. 11% are living in youth-headed households, and 9% are veterans. Next slide, please. One of the things we wanted to note here is, looking at the breakdowns of people, of the demographic breakdown of people experiencing homelessness as it relates to the Travis County population. So all of the dots in red show the percent of people in Travis County who identify as that group. So for example, 8% of Travis County residents are Black, 34% identify as Hispanic or Latino. And the blue dots show the percent of people experiencing homelessness who also identify as those same categories. So one of the main things to note here, one way to think about this is if the blue dot is to the right of the red dot, that means that that particular demographic group is overrepresented among people experiencing homelessness. one of the main things we have noted for a number of years is that Black people are overrepresented among people experiencing homelessness. So 37% of all people experiencing homelessness this year in 2021 were Black, compared to 8% of the Travis County population. Another big discrepancy is people living with a disability. Again, you can kind of see that in the chart. Veterans are also overrepresented slightly in the population experiencing homelessness. Next slide, please. And so finally, we want to show two slides about the capacity of the system. This is the number of beds, both permanent housing and shelter beds in the homeless response system in January of 2021, and January of all of these years. The main takeaway here is that, since 2018, the number of permanent housing beds has really drastically increased from under 1,500 to more than 2,500 in 2021. Just even in the last year, between 2020 and 2021, there's about a 25% increase in the number of permanent housing beds. That's beds for rapid rehousing programs or permanent supportive housing programs. Next slide, please. And finally, this is the number of people who were housed in the system, either through a rapid rehousing permanent supportive housing program, or maybe through diversion, or they exited emergency shelter to a permanent housing destination on their own. As you can see here, that the trend line is very positive. There are more people that were housed in the system than there have been in past years. There were 1,879 people in 2020. Again, that's an increase over previous years. Next slide. So as just a recap of the results, one of the main takeaways is there has been a slight decrease in the total number in 2021 compared to 2020. And we wanted to point out some of the possible reasons for that. Sarah showed the eviction numbers in Austin that have been much lower than in past years, but also much lower than other metropolitan areas in the state and also across the country. So the eviction moratorium has, I think, had a very positive impact, and the local moratorium, as you all know, has been extended to August 1st. This is just one thing to note, though, that I think once that ends, we're worried about the effects that will have long term. Average rents in Austin did stabilize somewhat, but they have already started increasing since early 2021, so that's another concern. Another reason for the slight decrease in the total number in 2021 is that fewer people accessing services due to COVID-19. Some of the concerns over being in close proximity to others is one possibility. Also, the Pro-Lodge program, or the Pro-Lodges, 164 people were in the Pro-Lodges and exited to a permanent housing destination. 13 exited to temporary housing. So that has, I think, dampened the effect of COVID-19 and the economic impacts of that. So I think that could account for the slight decrease in number of people experiencing homelessness. Another main takeaway is that Black Austinites, people living with a disability, and veterans are still overrepresented among people experiencing homelessness. And another takeaway here, and we didn't show some of the figures, but you can see this in the report, is that Pro-Lodge residents and people who are living unsheltered are on most measures very vulnerable, and more vulnerable than those who are living in shelters. And again, that's something that you can see in the report that we published today. And I'll turn it over to Sarah now.
Next slide, please. Thank you. Okay. Chris, if you could populate that slide for me, please. Thank you. Okay, so just a few key takeaways. Can you all hear me? I'm not, my square is not coming up as, okay, there we go. Okay, so a few key takeaways with this 2021 HMIS method. I just want to make really clear that the HMIS method versus the in-person PIT count, these are different methods. They're not interchangeable and can't be compared year to year. They're not apples to apples. So for example, if someone were to take the 2020 PIT count unsheltered number and then compare it to the 2021 HMIS method and calculate a % difference, that would not be considered a best practice in data interpretation. Another point that we want to make is that, yes, visible homelessness has increased, but actual homelessness has not, according to our methodology, yet. But we anticipate a possible delayed rise in homelessness when the eviction moratorium and unemployment benefit ends, and as rents continue to rise, and as people feel more comfortable accessing services out in the homeless response system. Next slide, please. So just really quick, a few wrap-up slides. Just want to point out some efforts towards racial equity in our homeless response system. We have a racial equity task group that made some really exciting changes this summer to improve racial equity prioritization in our system. They're currently piloting and developing additional recommendations. And Austin was also invited to participate this past year in a HUD racial equity demonstration project. We were one of 8 communities across the country, and those there's some exciting plans that will unfold in the coming year that will involve engagement with organizations that directly serve the Black community, and development of some additional data collection tools and policies to further equity in our system, equity and access. Next slide, please. So we have many, many partners, as you can see. I won't go into them in detail here, but in the last year, our continuum of care partners and our system-wide partners did some incredible work against some very, very substantial odds, because the homelessness crisis on top of the COVID-19 pandemic made for a really challenging mix, and yet all of these partner organizations still really came through and provided a lot of outstanding services to people experiencing homelessness. And in the future, the city of Austin is working on converting 2 additional hotels. The Housing Authority of the city of Austin is expecting to get an unprecedented number of housing vouchers. We had a summit, a multi-partner summit to end homelessness, and there will be a kind of a surge starting this spring, and many other exciting developments that are happening. And again, we can provide this as reference if anyone would like a copy of it. Next slide, please. And with that, I think we could turn it over for questions. I also want to make sure that we introduce Matt Malika, our executive director, and Whitney Bright, our HMIS director, all of whom have been really integral in this work, in case anybody has any questions for the panel.
Yeah, all right. Thank you very much, Sarah and Akram, and welcome Matt and Whitney to the conversation. So a few questions so far. This first one is pretty brief. If Sarah or Akram, you want to add just a couple words about it, but was the HMIS data pulled on January 28th of all 3 years for the comparisons? So is the methodology that's included in the report, is that the same methodology as we used this year? If one of you just wants to address that quickly.
Sure, yeah, it's the same exact methodology. That the dates are all in late January of the previous year. So it was January 28th of 2021. In the past years, it was the date of the PIT that was conducted in that year. So it'd be something like January 29th, I think, and January 21st, somewhere around there. So they're all in late January of those years.
All right, thanks, Akram. The next question is from Austin Sanders. Matt, this one might be for you. Were there any findings from the new one-day estimate methodology that require ECHO and its partners to adjust the broader strategy for reducing homelessness in Austin-Travis County?
Yeah, great question, Austin. I think the main thing that the last year has taught us about how to work with people experiencing homelessness is mainly we're looking through the lens of the congregate shelter setting. We've seen, we had to see a decompression of the congregate shelter setting due to COVID this year, obviously. And I think that there's a likelihood that we will not see a traditional return to congregate shelter in the future to the extent that we've seen it in the past as a strategy for reducing unsheltered homelessness. So you can see a lot of communities moving away from the congregate shelter and into non-congregate shelter settings. And I think that is a shift that Austin is ready to make and is already in the process of making through the transition of, as you knew, the roadway and in suites to a non-congregate shelter site. And I think there'll be more to come there. I would say in terms of strategies to reducing unsheltered homelessness, along with the changes in potential emergency shelter, we are still really focused on the acquisition, construction, and creation of affordable housing, deeply affordable housing in this community. I think this isn't a change to the strategy, but we just, it continues to highlight the need for actual housing units to serve people experiencing homelessness in particular, and to not rely on the private rental market as our sole answer for housing units for people experiencing homelessness. And so I think that focus has just been hardened a little bit, and they're continued. You can see it through some of the strategies that are being put forward around how to expand the housing stock here in Austin, Travis County.
All right, thanks, Matt. This next question is from Tahara. Can you explain why people in the pro lodges are more vulnerable than those in shelters? And I think this question could be for anyone who wants to jump in.
Sure, I can jump in on that. They were more vulnerable by design. So when we screened our population of people experiencing homelessness, we did so looking at the CDC screening guidelines to see who is at greatest risk for hospitalization and death. And so if those people screened, they were more likely to be accepted into the pro lodges because they were high risk.
Yeah, and I can point to some numbers that kind of reinforce that. I think about 3/4 of people staying in the pro lodges reported trauma as contributing to their homelessness. About half had been hospitalized in the last 6 months. 2/3 had visited an ER in the previous 6 months. And again, just to reiterate that, this was kind of, the pro lodges were for people who were at high risk of contracting COVID-19. So I think they have more health vulnerabilities. And that's one of the things that we did see that was borne out in the data. But also, people experiencing unsheltered homelessness had some of the same kind of vulnerabilities as well.
Right. The next question comes from Bridget. Are you all worried about an increase in the count due to evictions surging after August 1st? Akram, maybe you want to take a stab at that one.
Sure. I think, there's a lot of research that has shown that affordable housing market indicators, and evictions all contribute to the rate of homelessness in cities across the country. And I think that that's no different here than it is here in Austin. I do think that if you look at some other cities, if you look at the eviction lab data, their eviction numbers did not go down as dramatically as they have in Austin. And I do think that helps explain some of the numbers here. But yes, I'm very concerned that after August 1st, that those numbers will go up back to what they were. And I think, again, another factor that has been shown to increase homelessness is rent prices, average rent burden. And we know that that's really high among especially people with low incomes. And we're concerned that the rise in rent is going to also contribute to an increase in homelessness in the next, it may not be immediate, but in the next months and couple of years.
All Right, awesome. Thank you, Akram. This next one comes from Fred. I'm going to try to interpret this one a little bit, Fred, so just let me know if I misinterpret here. So it's, what do pro lodges look like physically? And Matt, maybe you can talk a little bit about this from a standpoint of the kinds of services that are provided here, provided at the pro lodges, and kind of how they function for the people who are staying there.
Yeah, sure. So all 5 pro lodges or hotels, or we're 4 now, but when they were 5, they were leased or acquired hotels by the city of Austin, and so they're all non-congregate space from that scenario. All of them have their own bathrooms and have food storage, and some have kitchenettes. On-site services include, 24-hour, 7-day-a-week security on the site, and then of course, front desk and operations staff, and then the supportive services in place, behavioral health and mental health care, case management, and what we call housing navigation services. So when folks get access to a housing subsidy, they help those people, navigate the paperwork associated with that. And then the community care clinic provided physical health care on site at all the different pro lodges, sort of on a rotating basis. So they would show up at the different pro lodges certain times of the week across the 5-day or 7-day week. So really just a really intentional and well done sort of suite of services provided at the pro lodges. Also, just to mention that there was a food service, 3 meals a day provided, laundry services and things like that. So just a big operational sort of task associated with that as well.
All right, I'm going to stick with you, Matt, for this next one. How will the ban on public camping affect ECHO's ability to help connect people with permanent solutions to homelessness?
Yeah, I mean, I think, certainly the providers that are doing the direct service work, our ability to count people experiencing homelessness through and understand our homeless population will be impacted based on just having access to those folks. Certainly the idea of, when, like in the last 18 months, when the ordinances, when homelessness was decriminalized, if a case manager or outreach worker came into contact with someone experiencing homelessness, they could immediately work on physical health needs, access to housing. What we know about what will happen now is once once tickets start piling up, you're going to be focused more on handling things that are, to make sure that they don't have warrants, to take care of any, potential criminal trespassing or ticket charges they might have. So it just kind of shifts the focus of the work away from what we know is, permanent housing, a focus on, engaging in permanent solutions to end homelessness, and creates more of a day-to-day crisis response of where am I going to be tomorrow? Where can you contact me? How can you get in touch with me? Can you take me down to resolve this ticket or this fine? Or, it just creates a more immediate focus on the crisis in front of people, and less of a focus on being able to plan for a future where they're not experiencing unsheltered homelessness. And I think, all along, ECHO's position on this has been really just that we know, that the criminalization of homelessness is not a solution to end homelessness. It makes it harder for people to exit homelessness into housing. And that focus of, keeping housing at the forefront of the work for people will change a little bit, and will be more of a crisis management discussion of getting basic needs met.
Thanks, Matt. The next question, I think could go to any one of you, maybe Sarah, Akram, you want to jump in first here. Can you please explain again about how the efforts to mitigate COVID-19 added to the visibility of homelessness?
Sure. Yeah, so there were various factors. Again, shelters had to reduce their capacity due to CDC guidelines for social distancing. So some of them decreased as much as half their capacity. And then, of course, people were reporting fear. People that might have normally felt comfortable staying in a shelter reported fearing contracting COVID-19 in that setting, even with those CDC guidelines in place. In addition, most of our partner agencies put on their websites, their wish lists, requests for donations of tents and other camping supplies. So whereas in prior years, somebody might have been sleeping rough, or you might have had more than one person in a tent, now you had more people, individuals with their own tents, thus increasing the visibility of tent camping. And then again, the CDC guidelines recommended not moving encampments, not disturbing encampments if there were no housing options available. So that allowed people to remain in encampments for longer. And the longer they're in encampments, the more belongings accumulate and increases the visibility of campsites. In addition, there was lower housing turnover due to COVID-19. Part of that was due to the eviction moratorium. We weren't seeing as many houses turnover, apartments turnover. And so there was an increase in the average length of unsheltered homelessness. So again, increasing the visibility and the number of belongings that people could accumulate in that time. So those are kind of the key factors that were contributing to an increased visibility of homelessness in our community during the pandemic.
All right, great. Thanks, Sarah. This next one, I'm not sure if we will be able to answer it, but Matt, maybe you want to take a stab at it. At what point will shelters and pro lodges return to full capacity?
Yeah, so I think we're seeing that happen in some of the congregate shelter settings now, where the Salvation Army downtown shelter and front steps at the Arch are increasing capacity slowly in accordance to national recommendations. And then as far as the pro lodge capacity, I mean, I think we're starting to see, and this would be, like Chris mentioned, probably a better question to ask the city of Austin, but we're starting to see that some of those pro lodges, like we talked about with the roadway in, start to transition to what will be their more permanent state. So, turn into a non-congregate shelter setting. We have a couple of pro lodges that we turn into permanent supportive housing. And, but again, I think that question is probably a better one for the city of Austin.
Thanks, Matt. Emma, your next question here, that's something that we're going to have to get a couple more details on. So let's you and I connect after this is done, and we'll get a couple more details to you before your deadline for that. And then finally, the last question I've got in the chat right now, and Akram or Sarah may be best for this. What type of disabilities are you seeing among people experiencing homelessness? Physical, mental, combination. How did this contribute to them sliding into homelessness?
Chris, can I just get the last part of that question really quick, and then Akram and Sarah, if you're happy to have you.
Great.
At the first part. So I think one of the things, just to be clear on, in a distinction around how this is reported on, Fred, that I'd like to caveat is that physical and mental health and substance treatment aren't necessarily causes of homelessness broadly, because many people who have physical health conditions, mental health conditions, and substance treatment conditions are stably housed. It is the wearing of the the sort of worn down fabric of the folks that end up falling into homelessness in terms of their social connections and familial connections, in order to be able to maintain them through those periods of health emergencies that create where those issues can create homelessness. So I mean, there are many families across the country that have histories of substance abuse, mental health, physical health conditions that never will experience, anyone in their families will experience homelessness. So I just want to make sure we caveat the responses you might get from Akram and Sarah to say that when those are the causes of people, sliding into homelessness, it's always because there are other structural things that play that make it so that their housing stability is already compromised. So I just want to make sure we caveat that. I don't want it to be, I don't want it to be construed that mental health, substance use, and deteriorating physical health are causes of homelessness broadly, because that's not true.
Yeah, and from a data perspective, we don't really know that these things are contributing to someone's homelessness. And I think that's a great caveat, Matt, that a lot of this is that some of these things are happening because someone has experienced homelessness. And when they interact initially with someone as, case manager or service provider, often they had already experienced homelessness for oftentimes a long time, right? And that's, kind of contributing to the mental health issues and the chronic health issues that we see in the data. So it's really hard to parse out what is causing what from the data. So I think that's a important distinction to make. But I think, to Matt's point and to add to it, I think about 2/3 report a mental health problem. And again, that could be as a consequence of the living situation they're in. I'd say about, maybe 50% report some chronic health conditions. And I think a quarter or so report developmental disability. Yeah.
All right, thank you, Akram, and thank you, Matt. I believe that is the final question that was left in the chat. Please, if I'm missing one, if you dropped a question in and I missed it, please let me know. But seeing and hearing no other questions, I think we'll go ahead and wrap this up. Matt, Akram, Sarah, any final words?
Yeah, I'll take a minute just to first thank everybody for their coverage on this and taking the time to better understand the information and the data that's been put out. Of course, just to recognize Whitney, Akram, and Sarah, whose teams and departments put a ton of work and effort into this. I think our request to you all, and I think to the broader community, is to sort of honor the amount of work that went into understanding this data from our perspective and to contextualizing it, and to please ask the questions you need to get the right context. We all know, and you all are very aware of the attention being paid to homelessness right now in the community, and the desire for people to compare Austin to other cities across the country, and certainly here in Texas. ECHO is making a lot of effort and has always made effort to be transparent around this and not in any way trying to misconstrue the data that's out there. So I just want to make sure that you all, if you have any questions about anything that you've heard or seen and need clarity when writing your piece, please reach out. I will make sure that we have somebody available. I will be available anytime, as you're meeting deadlines, to make sure that you get this information correctly, out there. And so it's really important to us and certainly important to the community. And I appreciate all that you all have done to get it right to this point and to take the time to report responsibly on it. So thank you.
All right. Well, thank you all very much for being here. As Sarah said in the chat, asking thoughtful questions. We do appreciate all of you and your coverage on this issue. So I put my email and my cell number in the chat as well. If you do have any of those follow-up questions today, I'll be able to either get an answer for you or connect you with someone who can get that answer. So please, as Matt said, don't hesitate to reach out. We want to make sure that we get you all everything you need to be able to communicate this in an effective and impactful way. So please reach out if you have any other questions, and thank you all again for being here.